How long does it take for an ankle sprain to heal? If you've recently suffered with an ankle sprain, it can keep you from walking or running or doing other sporting activities that you enjoy. And you may wonder, how long is it going to take for my ankle to get better so I can get back to doing all those things that I want to be able to do? I'm Dr. Dave Candy, and in this video, that's exactly the question that I'm going to answer about how long it takes an ankle sprain to heal. And I'm going to cover mild ankle sprains, moderate ankle sprains, severe ankle sprains, as well as ankle sprains that have lasted longer than they should. Additionally, I'll give you some tips and tricks that you can use to speed up your recovery time so that you can heal your ankle sprain faster and get back to doing all the things that you need and want to be able to do. So first of all, what causes an ankle sprain? Well, usually it's caused by rolling your ankle inwards, and that stretches or tears the ligaments on the outer side of the ankle. Now, a mild ankle sprain or a grade 1 ankle sprain is where the ligaments are just stretched slightly, but they aren't torn, there's no structural damage, and that type of ankle sprain usually recovers in 1 to 3 weeks. Now, during that time, there are a few things that you want to do to protect it. In fact, the acronym is PRICE. It used to be RICE, rest, ice, compression, and elevation, but they added a P component to that, and that P stands for protection. So now it's protection, rest, ice, compression, and elevation. And those are useful during the acute phases of the ankle sprain. But for a grade 1 sprain, there's usually not a lot of structural damage. Sometimes there isn't even a whole lot of swelling. So not all of those tips necessarily apply. Now, if you can't put weight on your ankle initially, then you do want to get an x-ray. There's a really valid rule to help you decide if you need an x-ray, and that's called the Ottowa Ankle Rules. And essentially that says that if you don't have bony tenderness on either the outside of your ankle or the inside of your ankle, or the bony part on the inside or outside of your foot, and you're able to take 4 steps immediately after your injury, then you very likely, 98-99%, don't have an ankle fracture and you don't need an x-ray for it. But a mild ankle sprain, again, is just where the ligaments have been stretched tight a little bit, but there's no tearing. And so a lot of times you don't need a brace if you're able to put weight on it comfortably. You usually may not need to even ice it if there's no swelling. You might not need to compress it with an A-strap, and you might not need to elevate it. So that PRICE method really might not apply that much if you just have a very mild grade 1 ankle sprain. Now, you do want to start moving it right away. That movement brings blood flow and nutrients and oxygen to the ligaments to allow it to heal up as quickly as possible. It also helps you from developing stiffness in your calf muscles or in your ankle joint itself that could hinder you down the road. So really, for a grade 1 sprain, you just want to treat it symptomatically and get moving as early and as quickly as possible. Now, for a grade 2 sprain or a moderate ankle sprain, that's where the ligaments have been torn just a little bit, not completely ruptured, but torn a little bit. And so in that case, protection probably is a little bit more important. You probably will want to use an ankle brace on it for a little while to give a little bit of protection to those ligaments so you don't cause further damage or roll your ankle again while those ligaments are healing up. And the ankle braces that I think are most helpful are ones that they slip on like a boot. They have some laces on them that you tie up, and then some figure-8 straps that you strap around the ankle. And I'll put a link down below this video for the type of ankle brace that I'm talking about. But those are usually good to wear for a couple of days up to a couple of weeks. Again, a grade 2 ankle sprain can take 4 to 6 weeks to heal. And during that time, you want to gradually increase the weight bearing that you're putting on the ankle. If you can't walk without a limp for the first couple days, you may even need to use crutches until you can walk without a limp. Additionally, you want to get the ankle moving as quickly as possible, just doing some motions up and down like that. You definitely want to stretch your calf muscles. If you can't put weight on it at first, just pulling your toes up either with your hand or using a towel to pull up on them if you can't put weight on it is something that can be helpful initially. But as quickly as possible, you want to get weight on your calf and stretch in the motion like this, where you've got your foot on the ground and you're actually getting your body weight out in front, because that's functionally how we use our ankles. We don't use our ankles in a non-weight bearing position like this very often. So you want to get back to using your ankle the way that you functionally use it as quickly as possible. Now, after your ligaments have healed up a little bit, additionally, you want to improve your balance on your foot, because your ankle muscles help balance your body over top of your foot as you're walking, running, jumping, especially if you do high impact activities like running and jumping. You're really going to want to improve the muscle function around your ankle. Additionally, the ligaments in your ankle, they have some proprioceptors in them. And what that means is they're sensors inside the ligament that tells your brain where your ankle is in space. And when you've sprained your ankle, you get those proprioceptors damaged a little bit. And it takes some time for you to retrain those and help get your sense of awareness or spatial awareness where your ankle is in space so that you don't re-sprain it again in the future. So the easy way to do that is just practicing balancing on one leg like that. If that gets really easy to do, then you can start using uneven surfaces, either balance boards, balance pads, standing on top of a pillow if you're doing it at home, anything to make it a little bit more challenging. Now, as you get further out, as you heal your ankle up a little bit further, then you want to get back into higher impact activities. So that may mean getting back into jogging or running or jumping if those are things that you do. If you're not someone who does those things, then just getting back into walking may be all you need to do. Now, what about the grade 3 ankle sprain? How long does it take for a severe ankle sprain to recover? Well, if you've had a severe ankle sprain where you've torn the ligaments completely, you're probably going to have a longer protection period, probably a couple of weeks inside an ankle brace, maybe even a walking boot if it's really, really bad, but you're going to want to brace it or be inside a boot for a few weeks. Then once you get out of the boot, then you start going through those steps like I mentioned for a grade 2 ankle sprain. It's just going to take you longer to hit those landmarks of getting your mobility back by doing calf stretches, working on your balance on one leg, and then getting back into higher impact activities like walking, running, jumping, and things like that. Now, the final level that I didn't mention earlier is after you've started running and jumping again, then you want to get into directional changes if you're in sports. So doing cutting and pivoting activities, that would kind of be the last stage where you're most likely to sprain your ankle or roll your ankle again when you're doing a cutting or pivoting type activity. Now, finally, what if you have ankle pain that's lasted longer than it should? Let's say you've gone past 12 weeks and you're still having pain in your ankle. What do you do then? Well, by 12 weeks, your ligaments should be very well healed up anatomically. But sometimes if you've had a severe ankle sprain where you've torn ligaments, maybe got some joints out of place, there's a joint up by your knee that gets injured sometimes if you've had a severe ankle sprain. In that case, it can get a nerve called your fibular nerve overly sensitized, and that can cause some lasting pain even after the tissues have still healed up. And if your tissues have healed up, but you're still getting those signals telling your brain that something's wrong down there, it's very likely that that nerve has gotten overly sensitized. And at that point, you definitely want to seek out treatment for it. Seeing a physical therapist to help figure out if there's still some joint dysfunctions in your ankle to help you get your ankle moving again, because a lot of times that happens when an ankle sprain was poorly treated at the very outset. Maybe you didn't move it enough initially, or you were told to be in a brace or a walking boot and not to do anything. And sometimes that fear of movement can actually make those nerves a little bit more sensitive. So usually ankle pain that's lasted longer than it should and become chronic past 12 weeks usually has to do with sensitive nerves. Now, if you have an ankle sprain that you either want to get moving quickly so that you don't develop more of a chronic pain in it, or if you have an ankle sprain that's lasted past 12 weeks and you're still suffering from it, if you happen to be in the St. Louis area, we'd be happy to help you out with that at More for Life to find out what's wrong and what you need to do to get your ankle moving again so you can get back to all the activities that you enjoy. And no matter where you're watching this from, if you did find this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching and have a great day.